Chemotherapy and radiation therapy are common treatment options for biphasic mesothelioma. However, they both often come with significant side effects that patients should be aware of before starting treatment. Though they can help slow or stop cancer growth, the side effects arise due to these therapies also damaging healthy, fast-growing cells in the body. Some of the most common side effects of chemotherapy for mesothelioma include fatigue, nausea and vomiting, appetite changes, hair loss, mouth sores, infection risk, nerve damage or problems with thinking clearly. Chemo brain fatigue is one of the most frequently reported effects, where patients feel excessive tiredness even after minimal physical activity or mental exertion. This extreme lack of energy can make it difficult to do everyday activities. Nausea and vomiting are also very common, often occurring hours after treatment and varying in severity. Anti-nausea medications often help manage these symptoms, but don't eliminate them entirely for all patients. Changes in appetite are also typical, with loss of appetite occurring in some while others find themselves hungrier than usual. Hair loss is another well-known side effect, as chemotherapy damages hair follicles, causing hair to thin or fall out completely several weeks after treatment begins. Mouth sores or infections also frequently arise due to cell death in the mouth. Other symptoms like diarrhea, constipation, joint and muscle pain, menstrual changes, and shortness of breath can occur as well depending on the drugs used. As for radiation therapy specifically, some of the common short-term side effects during treatment include skin irritation, fatigue, nausea, vomiting in some cases, cough, chest wall pain and difficulty swallowing if the radiation is near the esophagus. Longer-term side effects could potentially include scarring or fibrosis of the lungs and heart, which may lead to issues like shortness of breath or cardiac problems later on. Radiation pneumonitis, where the lung tissue becomes inflamed, is also a possibility months after treatment ends. In rare cases, myelosuppression, where the bone marrow is suppressed, can occur with radiation treatment as well. While the radiation beam itself is carefully targeted, there is still potential for damage to nearby healthy tissues and organs. The side effects tend to be cumulative over the course of treatment and can worsen before improvement. Supportive medications may help manage some symptoms as well. Now that I've outlined the major categories of side effects to expect, I will provide more detail on specific symptoms and how severe they tend to be for mesothelioma patients. Fatigue is reported by 50 to 90% of mesothelioma patients receiving chemotherapy or radiation therapy. It is usually moderate to severe in intensity, peaking 1 to 2 days after treatment and lasting 4 to 5 days or more. Even basic tasks like taking a shower, getting dressed or preparing a simple meal can leave patients exhausted. Radiation therapy on its own also commonly causes pronounced short and long-term fatigue due to local tissue damage. Nausea affects around 40 to 80% of mesothelioma patients undergoing chemo. It usually lasts a few hours to all day and may be associated with vomiting in 30 to 60% of cases. Anti-nausea drugs like 5-HT3 receptor antagonists, corticosteroids, benzodiazepines and NK1 receptor antagonists can help reduce risk and severity significantly but don't work for everyone. Combined with dehydration and malnutrition, it can seriously impact quality of life during treatment. Appetite loss occurs in over half of patients, which may lead to weight loss if not addressed. Changes in taste sensation also commonly occur, which can persist months after treatment ends. While some find certain foods repulsive, others develop cravings or ravenous appetites between treatment cycles. Nutritional supplements are often needed to avoid malnutrition. Alopecia or hair loss from chemo affects nearly all patients within 2 to 3 weeks of starting treatment depending on the drugs. Eyebrows and eyelashes are also frequently lost along with scalp hair. For most it grows back within a few months of finishing treatment, but scarring alopecia can occur in rare cases where hair does not fully regrow. Mucositis, or inflammation and ulceration of the mouth and gastrointestinal tract, occurs in 30 to 60% of chemo patients, especially with certain drugs like 5-fluorouracil. Oral pain ranging from mild to severe and bleeding gums are symptoms that usually peak around day 10 of treatment and may worsen eating or swallowing for 1 to 2 weeks. Good oral care is important to prevent infections. Fatigue, nausea and appetite changes are also very common with radiation therapy alone or combined with chemo. For treatments involving the chest cavity, over 50% of patients report these digestive issues along with shortness of breath and cough. Skin irritation in the treatment area can cause burning, itching or redness as well. These short-term effects tend to subside within weeks of finishing radiation, but some cardiac or lung problems may manifest later. While side effects like low blood cell counts, diarrhea, constipation, muscle or nerve pain have more variable rates, serious complications like neutropenic sepsis, bleeding issues or treatment-related leukemia are relatively rare at 1 to 2%. Likewise, long-term effects beyond a few months of treatment are infrequent. With adequate supportive care, the vast majority of side effects are temporary and reversible. But they still require vigilant monitoring and management throughout treatment to optimize patient well-being and comfort through a very difficult time. Overall, personalized symptom control and quality of life should be a top priority when weighing therapy options with mesothelioma patients. Chemotherapy and radiation therapy can be effective against biphasic mesothelioma but also carry significant potential for short and long-term side effects involving several organ systems. Fatigue, nausea, appetite changes, alopecia and mucositis top the list of common chemo side effects. While radiation brings its own risks of lung, heart fibrosis, pneumonitis or skin irritation, close medical management by an experienced team can help minimize complications and distress from these important therapeutic modalities. But patients must go into therapy with informed expectations of side effects so they can plan accordingly. Making side effect prevention and relief a priority is key to optimize tolerance and adherence to potentially life-prolonging cancer treatment.